quite a common injury that we see is in the knee joint, and that is of what is described as a pivot shift injury, and that is associated with ACL tears. So the mechanism of the injury is, it's usually when there is a deceleration or rapid change in direction, which obviously occurs very commonly in rugby. And that normally happens when the foot is planted and the ankle moves outward relative to the knee, and the femur or thigh bone rotates internally. That cascade of movements heavily loads the ACL, and if that load is sufficient, then you can have an injury of the ACL. And that can be anything in the spectrum of a complete tear, so there's complete discontinuity of the ligament, to a partial tear, some fibers are torn and some remain intact, or a mild injury where there is a ligament sprain. The imaging of that usually starts with an X-ray to exclude a fracture. Sometimes we can see some bony changes that suggest that there is a ligament injury, although obviously X-rays don't show the ligaments directly. And we may see fluid in the joint or swelling or edema, which suggests that there is significant injury to the knee. So MR is the gold standard for imaging when one suspects an ACL or anterior cruciate ligament tear. And the ligament is like a rope, so it normally looks as a dark band of tissue that joins the femur and the tibia. And we'd look for discontinuity. That's the best sign that there is an injury of the ligament, that it's completely discontinuous, the fibers are not meeting, and there is a fluid-filled gap. Sometimes the ligament sags, so instead of being a tight rope, it actually flops down and is lax. That is also another good sign that the ligament is injured. And then we can look for other signs to say that this injury mechanism has occurred. So there are certain patterns of what we call bone bruising, where we see a bright signal or edema in the bone that tells us that a pivot shift injury has occurred. And then with a pivot shift injury and an ACL tear, there are a whole host of other associated injuries that we look for. The collateral ligaments, those are the ligaments on either side of the joint, those can be injured. And the menisci, both on the inner side, the medial and the lateral side, they can be torn. And then the articular cartilage, the cartilage that covers the bone, can also be injured. And then there are obviously associated soft tissue or muscular injuries. And MRI is an exquisite imaging tool that can assess all of these and give a grading and allow the referring physician, be that a doctor, orthopod, or a paraclinical healthcare professional, to make a diagnosis and plan the patient's treatment.
Well, it was quite simple. I went for my appointment, and it was a woman. She took me in. She told me to lay as still as possible. But yeah, seeing the machine was quite like an eye-opener almost. You don't know, and it was my first time as well. And laying there, you're hearing sounds and stuff, you're like, what's going on here? But now, all in all, it was quite simple. You can hear speaking. She spoke to me when I was lying there. So, no, it was quite simple, not stressful at all. Yeah, the most difficult part for me was just to lay still for half an hour. So that was actually the most difficult part.
When you arrive at the department, we will ask you to change into a gown if necessary, and also depending on the severity of your injury. We will then take you through and receive signed consent. Thereafter, you will go to the specific exam that the referring doctor requested for you, be it an X-ray or CT or an MRI. We will go through questions, should it be relevant. If you are getting an MRI, it is important for us to know if you have any implants in your body that make it unsafe, or if you are getting a CT scan. We do not usually inject IV. However, if the need be, we need to know if there are any allergies that you have.